I've had a lot of response from those of you after I posted on Facebook and after you saw Elizabeth Cohen on with me. She's got a new book out. It's called The Empowered Patient. You got to buy it. It's an easy read, an inexpensive book, but it's what Elizabeth is committed to, and that is allowing you to be an empowered patient. One of the things she covers in her books are in her book is what happens when doctors get it wrong. How do you be an empowered patient and step up? We're also intimidated by this whole thing. Elizabeth Cohen, our senior medical correspondent, is with us here in studio. It doesn't matter what you do for a living and how important you feel at your job. When it comes to facing a medical problem or being in a doctor's office, you are the small player. You are not, you don't feel like you're in charge.
That's it. You're in their world.
Yes.
When you're in the hospital, you're in their world. Yeah. You're just a guest in it. And you know what? Things don't always go right. For example, doctors have done studies where they look at cadavers. This is awful. And they say, hey, what did they die of? And what did the doctors say they died of? And they found that about 15% of the time, doctors are wrong. So I want to introduce you to a real pioneer of the empowered patient movement. Her name is Trisha Torrey, and she's coming to us from New York. And welcome to the show, Trisha.
Thank you. Thanks, Elizabeth. It's great to see you.
Well, great to see you. Trisha, I included your story in the book because it is so incredible what happened to you. So tell us your story.
Well, in the summer of 2004, I found a lump on my torso. It was about the size of a golf ball. Eventually, I got to the doctor. They removed it, and they called me 2 weeks later and told me that I had a very rare type of lymphoma. Subcutaneous panniculitis-like T-cell lymphoma. Of course, I went instantly to the internet to see what I could learn about it. And mostly what I learned was that it was very, very rare and that anybody who was diagnosed with it died either within a few months or if they tried chemo, they might buy themselves an extra year. From there, my gut just told me there was something wrong. I felt fine. They ran a CAT scan, they ran blood work, couldn't find any other evidence of that cancer. And eventually, making a very long story short, as you can imagine, I was able to show that I didn't have cancer at all. And eventually, that was confirmed by the National Institutes of Health.
Trisha, let me just ask you this. What's step one in this? Because we would all like to not have what the doctor says we have. What is step one? Who do you first tell that you think this is not the right diagnosis?
Well, I say this to you, giving you some of my best advice, because I actually made all the mistakes patients could make. And so when I first started asking about it, it didn't occur to me that I didn't really have it. I was told that 2 labs had independently confirmed that I had this. Mm-hmm. And so I would say to anyone else that when you're given a diagnosis, the first thing you need to do is ask what else could it possibly be. And actually, Elizabeth, you talk about that in your book. What else could it be? But then the second thing you need to do is get a hold of those test records and the results and start looking them all up yourself to see if, in fact, what you're learning on the internet matches what you're being told by your doctors.
Right, I think that's so key. She talks about what you're learning on the internet, because sometimes doctors diss the internet.
I've heard a lot of doctors say, don't go do your own research. All sorts of crazy stuff is out on the internet.
And here's another place where the internet really helped. And Trisha, I'm going to brag on you for a minute. The mother of a 15-year-old boy named Danny Pagan Figuera, Danny was also diagnosed with this same horrible form of lymphoma. And on the internet, the mom found Trisha, and guess what? Danny didn't really have it. It was nothing. It was nothing. So that's really pretty incredible. There he is. He was in the hospital to get various biopsies, and it turned out in the end, because his mother questioned the lymphoma, and he was in the same situation as Trisha, where he was this close to having chemo, and it turns out he didn't need it. So Trisha, quickly tell us, every time you get a diagnosis, should you question it?
Well, I would say, Elizabeth, if you get something that's fairly simple, I mean, we all catch the flu, we all get colds, we all have poison ivy. If you get something like that, I don't think you really need to question it, because the treatment will probably be pretty similar to whatever it is the doctor thinks you've got. But at the point where maybe your symptoms don't seem to match those that you find should be classic ones, or if you're being treated for any period of time and the treatment isn't working, or at the point where your diagnosis means you need some kind of difficult treatment, surgery or chemo, or a drug that you'll need to take for the rest of your life. At that point, I would say trust but verify. Most of the time, the doctor is right. But it doesn't mean that he's right or she's right in your case. Right. And so doing all that research can really give you better answers.
Great story.
Trisha Torrey, thanks so much. And you can read Trisha's blog at about.com. She's their patient advocate.
Very good. Trisha, thanks very much for joining us. You know, I haven't seen you a lot in the last few months, but I've had a cough for over 2 months. It's mostly gone now. It's like 5%. But I was having trouble even doing my job. And the doctor kept trying different things. He ran a lot of tests. And he said to me at one point, he said, some things we only diagnose by how you respond to the treatment, because he had run all these tests. It showed nothing, but I couldn't talk for 10 seconds without coughing. And he said, we have to try different treatments on you just to establish what's wrong.
Right, as a way of diagnosing. Right, that's an important thing. The treatment is not just to treat you, but to see if actually the diagnosis is right.
All right, this book is chock full of this stuff. It is easy to read. I mean, I don't mean to diminish it by that. I'm just saying it's not a big commitment to go and buy this and to read it. And honestly, it is the kind of thing, it's like Sanjay's book, you can make your life easier and better, because we all end up as patients at some point or other, and we all feel as unempowered as ever before. So good luck, and thank you so much for putting this in print. And Elizabeth will be with us very regularly doing exactly this. Be sure.